Hey guys, what's going on? Dr. Natty here at Myokinetix Physical Therapy and Performance. And today we're gonna talk about that patella tendinopathy pain, which is the pain in the front of knee that you get, especially after an ACL surgery. For those who are listening, when you guys have the patella graft, they take a piece of your patella right here to turn into your ACL graft, right? That's why you're having that pain, especially when you start doing stuff. So today in this video, what we're gonna go over is like why this is happening, A, B, isometric exercises that you can do to actually help strengthen your quad and take that pain away, which is part of load management, and then C, some eccentric exercises that you can do to actually get rid of that pain once and for all. So let's get right into it. All right, so first off, like and subscribe to this channel, and then let's get right into it. So if you have a patella graft when it comes to your ACL, or you have pain in the front of the knee, usually what happens is that you have less of this patella tendon right here from the ACL graft, and you can see the point of patella tendon is to actually help you move your kneecap up and down and stabilize the knee at the same time. The kneecap sit right in front of your knee right here. So if this tendon is weak, it's gonna require a lot of force, right? And you can see it's gonna get inflamed extremely easily. So a couple things we like to do is we want to teach you A, how to strengthen the quad and the tendon itself, and then next we want to know how can you actually create some space between this patella so that way you can feel a lot better. And I'm going to walk you through that right now. So let's get right into that. All right guys, the first tool I highly recommend is you get this giant suction cup that you can get on Amazon. Size big enough, they're gonna cover your kneecap. So the first thing I'm gonna teach you to do is actually decrease some pressure that you have in the knee because your patella is actually sitting on the knee and it's grinding back and forth. So what we wanna do, we wanna actually lift up that kneecap and create some space for the patella tendon to move nicely. So you get this cup right here, you put a little lotion right around your knee, and all you're gonna do, you're gonna put it right in front on top of your kneecap, right there. As soon as you put it on, you're gonna feel that your kneecap is lifting up just a little bit, okay? So it's just some cupping therapy. From there, what I like to do with our patient is we like to just have them do some quad set right here and then slowly let this cup kind of lift up the knee a little bit. So I'm gonna hold this for 5 seconds. Again, that's why you need lotion. You're gonna hold this for 5 seconds. You can put some pressure on here. 5-second hold, relax. 5-second hold, relax. 5-second hold, relax. You do that 5 times. After that, what you're gonna do, you're gonna pin this down and then slowly just lift this up just a tad bit. And we're gonna do this for 30 seconds, okay? So what this does, we're actually creating some space for the kneecap to move just a tad bit because you have so much pressure building up in that front of the knee. And that's why you're feeling that pain in the front. Again, tendinopathy means it's just overworking, right? And if you're missing a piece of your patella tendon, you know the rest of the tendon is gonna be working really hard. It's kind of like a giant group project and, you know, 2 or 3 members of your group is not working, right? So it's just gonna overwork. So by the time it's done, you're gonna take this off and you can just move your knee up and down. You should feel almost an instant relief when you do this. So that's the first thing I like to do before we get into our isometric exercise to get the quads and to lower the patella gently so that way you're not doing too much. All right, another cause you can make your knee feel a little bit worse, the patella tendinopathy, is there's too much load. That means you're just taxing the knee a little bit too much. So what I like to do once the patient actually have those kind of symptoms, I say, hey, let's lessen the load right away. So what we're trying to do, we get them to do some isometric exercise, which means you're just gonna do a lot of hold, a lot of time under tension, where you can actually activate the muscles and decrease that tension in the tendon, right? So the first thing I like to do is the Spanish squat, right? Which is mean isometric squat, right? So you're gonna need something like this strap right here where it doesn't move, or you can get a thick rubber band that you can wrap around. All you're gonna do is place this right behind your knees, and you're gonna go into an isometric hold on the squat, right? So from here, I'm just gonna come right here, make sure it's nice and even. I'm gonna come down, slowly, slow. I'm gonna hold that right there, and I'm gonna lean back just a tad bit. So as I'm leaning back, you see like my quads are working, less pressure on the knee actually, because it's teaching me to load the muscle. I wanna hold between 15 to 30 seconds. We're gonna hold this right here till you feel like a nice shake, hold. So after 15 or 30 seconds, you're gonna slowly stand up. When you stand up, make sure you really squeeze your quad, right? With this, because it's a time under tension, I would go between 6 to 8 reps, 3 to 4 sets, okay? Lean back. Notice I'm trying to stay upright as I'm holding here. Again, if you're shaking, that's good. You can bring it up a little bit. If you go too low, you can feel this is working already. And if you do on a turf, put shoes on. Hold. So there's around 15 seconds here. We'll go for a little bit more. So I'm at 20 seconds. I'm gonna come right back up, squeeze my quads, feel my quads working already. Rest for another 30 seconds, and then from there we'll go right back to it because the muscle's gonna get fatigued extremely fast, okay? For all my athletes out there, I know you guys wanna lift heavy weights, you wanna push that, but right now you really wanna take care of that knee pain so you can push weights later. Hold, This is a really good thing to do at the early stage of ACL. Hold. There you go, I'm already feeling the burn. I'll do another 5 seconds here. So you see I'm shaking. From there, come all the way up, squeeze, all right? So that's the Spanish squat. That's the first exercise that we give you. All right, guys. After we just lowered the Spanish squat, which is double leg, now we can challenge ourselves by doing a single leg in a split stand variation. I like to do it elevated, so that way I can load the quads a lot quicker, right? So again, you get a plate where you feel comfortable. You kind of step back here, right? You want to put 80% of the weight in the front leg, 20% of the weight in the back leg. You're just going to come down to where you have no pain, okay? We don't want any pain in the front of this knee at all, right? So once you feel that, you have no pain, same thing, 15 to 30 seconds, 4 to 6 reps, 3 to 4 sets, and you're going to hold that there and hold. Right? The one cue I like to give my patient is that make sure you're pushing against the ground. You're pushing into the box, right? Because gravity is pulling you down. You want to generate force against gravity. You're going to hold, you're going to feel your quads, you're going to feel your glutes, you're going to hold this here. And this is a really good way to train that athletic position, right? If you're going to run, you're going to cut, you're going to jump, this is the position you need to be in. We're going to hold, see my legs shaking a little bit. 5 more seconds, we're going to come up. And then from there, as I come up, I squeeze my quad. Then I'm going to give this leg a rest, go the opposite side, come down, pain-free range of motion. If you can go deeper with no pain, go deeper. And we're gonna hold, but remember, you're always pushing into the ground, okay? Hold that nice and easy. Focus on just 80% here, go 10 seconds here. And from there, I'm gonna come up nice and tall, really squeeze that. Then again, alternate, switch side, come down. Try to get lower each time with pain-free range. Hold that right there, really feel your hips. If you feel too much in your back, that means you gotta lean forward a little bit more and load that hips move. Push into the ground, shaking is good. Come on up, awesome. And then I'll show you on the other side. All right, guys, next one's gonna be open chain knee extension. So this is really easy to do. You can do this at home. You can do this at your knee extension, at the gym where you put a lot of weight on, where you can't actually physically move the weight. We just want isometric, right? So all we're gonna do, we're gonna teach you to, again, load the quad and initiate the movement at the quads and not rely so much at the patella tendon itself. Right? So what I'm gonna do is I'm gonna get a box, get my knee at 90 degrees, a little bit like a couple inches off the wall right there. All I'm gonna do is I'm gonna think about slowly pushing and kicking into the wall, hold this here, and I'm gonna gently kick, hold that there, and we're gonna hold this again 15 to 30 seconds, 6 to 8 reps, 3 to 4 sets. As I kick more and more, you can see my muscle activating more, right? So this is teaching your muscle to just get that quad recruitment, right? It's huge actually when you're doing it for ACL testing, because we want to measure that quad to quad strength, right? This is how you teach some good basic step to learn to recruit your quads. You're gonna hold, kick, again, try not to lean back, try to just stay upright the whole time. We're gonna hold, 5 seconds more, and you're gonna relax. Then you're gonna alternate to the other side, same thing, don't lean back, kick, hold. And you're gonna notice one side might be stronger than the other because there's no pain. The key to this is to do this with no pain. Hold, try to focus on my muscle connection right there, really get that quad. And if you wanna know if you're doing it right, you place your hand on your quad right here. You should feel it shaking. Hold that there. 10 more seconds for me. There you go, 3, 2, 1. I'm just gonna keep alternating back and forth just like so. Again, if you're having a hard time, put shoes on, kick slowly. Like I said, if you're at the gym, put a lot of weight on where you can't physically move the weight, and then just kick. And you can do this as early phase of your ACL rehab to get that quad to start firing immediately. I'll go 5 more seconds here. Excellent. I'll alternate. Again, 6 to 8 reps, 15 to 30 seconds, 3 to 4 sets. And after you guys do all these exercises, you should be able to just finish and say, you know what, I feel really good. I don't feel my pain level going up. My knees feel good. That's the measure of success. There you go, 5 more seconds. And that's it. Okay, all right guys, to finish everything up, now we're gonna tie everything within some movement, some eccentric movement, which is nice and slow. You guys seen this before, some reverse sled drag. That's actually to teach you how to engage your quad, load them, and slowly produce force the other way around, right? So what you want a nice strap, pick some weight that you can do for longer distance, longer duration, so it's actually not way too much resistance, which is gonna actually flare up your knee even more, right? We wanna go for duration. So again, this one we wanna go 45 seconds to a minute, right? And we're gonna go 4 to 5 set on this one, okay? So you're gonna go just like the Spanish squat. You wanna sit into that position, and the key to this is you wanna slowly push off one leg at a time. Get full extension first before you take a step with the other one. So again, eccentrically loading it. Feel your quads, stay nice and low. There you go. Finish all the way before you step with the other leg. Get full knee extension first. Don't finish short. Good way to teach your body, back pedal, loading your quads, loading that patella tendon once again, slowly introducing some stress without flaring up that knee. I keep the knee angle at around 90 degrees. I'm pushing with my heel. And then from there, I'll turn around. I'll do exact same thing until I hit 45 seconds to 1 minute. Nice and slow. This is the pace I want. I don't want to go anywhere faster than this. There you go. It should feel nice and burn. Once you hit that 45 seconds, you're just gonna rest. And then you redo it again, 4 to 6 sets, whatever you can do. Make sure you build up that tolerance, that muscular endurance. Again, if you guys already got through this and your pain is gone, guess what? We have a next exercise for you, which is the quad strengthening exercise. That's actually gonna help you build your quad muscle. And you're gonna click right here. And if you want to make sure your hamstring is also staying strong and can keep up with the quad, check out this video right here. Again, my name is Dr. Natty. I hope you guys enjoyed this video. Please like, subscribe, and share, and I'll see you next time.